Welcome back, science adventurers, to Decoding Long COVID, Dexamethasone, and Beyond. I'm Dr. Shikha Agrawal, your guide through this molecular symphony where every note holds a clue to long COVID's mysteries. After diving into the big picture last time, I'm pumped to zoom in how dexamethasone works, its magic at the cellular level. So tune into this episode on dexamethasone's molecular magic. Prachi is back with us, ready to unpack the science. Prachi, let's get to it. How does dexamethasone actually work inside our cells to tackle long COVID's inflammation?
Thank you for having me here, Dr. Shikha. I'm excited to be here.
Well, Prachi, dexamethasone's got this reputation as an inflammation tamer, but what's happening under the hood? How does it work at the molecular level in long COVID?
Great question, Dr. Shikha. Dexamethasone is a synthetic glucocorticoid that mimics cortisol, binding to glucocorticoid receptors in nearly every cell. Once bound, the receptor moves to nucleus, acting as a transcription factor to tweak gene expression. It turned on pro-inflammatory genes like those for IL-1 beta, IL-6, and TNF alpha, while boosting anti-inflammatory ones like IL-10. In long COVID, where chronic inflammation drives symptoms like fatigue and joint pain, this is a big deal. A 2024 clinical infection disease study showed dexamethasone cut IL-6 levels by 30% in long COVID patients with high inflammatory markers. It's like flipping a switch to calm the immune system's overzealous alarm. But it's not perfect. It brought immunosuppression and can dampen helpful immune responses, raising risk of infections like candida, as a 2023 Journal of Infectious Diseases reported.
That's like a conductor silencing a chaotic orchestra. But you have got me thinking about the microbiome, especially with your bioinformatics lens. How does dexamethasone's action affect the gut? And how can we use data to make it smarter?
Spot on, Dr. Shikha. The microbiome's a key immune regulator. A dexamethasone can shake things up. It often reduces beneficial bacteria like bifidobacterium and lactobacillus, which produce anti-inflammatory SCFAs. A 2023 gut microbe study found long COVID patients on dexamethasone has a drop in 20% of these bacteria, which can worsen symptoms like fatigue by disrupting the gut immune axis. That's where bioinformatics come in. 16S RNA sequencing let us track these microbial shifts, and machine learning models like those in 2024 Nature Communications study predict who will respond best to dexamethasone based on their gut profile. For example, patients with higher clostridium level might see better outcomes due to anti-inflammatory metabolites. This helps us personalize dosing, minimizing microbial damage while maximizing the benefits.
Prachi, you have just conducted a masterclass in molecular music. Let's tune into what you have shared, like adjusting a symphony's strings. You have shown dexamethasone as a maestro, dialing down inflammation's loud cytokines like IL-6, with that 30% drop being a game changer for long COVID symptoms. But its broad strokes can mute helpful immune nodes, risking infections. The microbiome's head hard too, losing SCFA producers. Prachi, what's your big takeaway?
Love the maestro metaphor, Dr. Shikha. Dexamethasone's a powerful conductor, but we need to fine tune its performance. The microbiome's like a variant orchestra section that get disrupted, and bioinformatics is our soundboard helping us adjust the mix of each patient. We are like composers crafting a new score for long COVID treatment with precision medicine as our melody.
Thank you, Prachi, for your valuable insights. That's all for today's episode. Dear listeners, thank you for joining us. If you like the episode, hit subscribe, share the episode, and join us on social media with our hashtags. Let's keep decoding long COVID. Stay curious.